Hello everyone. Today's video is about MSM, also known as methyl sulfonyl-methane. There's been quite a few questions and comments on a couple of my videos recently about MSM, and I wanted to do just a little summary question Q&A video here to get through some of those. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I interviewed Dr. Kathleen Janelle on my podcast, the Overcoming Chronic Illness podcast, a little while ago, and there's just been a lot of interest in that episode. And then I subsequently posted another Q&A. I subsequently posted a Q&A video to answer a bunch of questions, and there's just more questions rolling in. So here we go. Rapid fire here, get through some of them. So it says, I've read about some synergistically beneficial combinations with MSM, i.e. magnesium/vitamin C and methylene blue, maybe other things too. Any thoughts on this? And that says may warrant another episode, which sounds good to me. Can interview myself about it, I guess. I don't know. Dr. Janelle is like the only person that I know of that talks about high-dose MSM, high-dose sulfur therapy, besides me. So if anybody has any suggestions for other docs you've heard of talking about this, a couple of medical doctors wrote a book about high-dose MSM many years ago, like 25 years ago. I found an old copy, and my mom actually had one. She's been collecting complementary and alternative health books for many years now. So I found that copy is very interesting, but they both passed away. I actually looked them up to see if they're still alive so I could interview them, and they're not. So if anybody knows any docs who talk about high-dose MSM besides Dr. Janelle and myself, please let me know. Post it in the comment section, and be curious to know about that. So in terms of synergistic agents, to my knowledge, there's not anything else that needs to be taken with MSM for it to work. Now, when we're using MSM to get the therapeutic benefits from MSM, I'm not aware of it being enhanced by taking something else, nor am I aware of anything interfering with its function in a direct way. Now, if I had a patient who had a lot of joint pain, for example, I would think to myself, I want to put them on MSM, but then I'd probably also think about putting them on things like glucosamine and chondroitin, and maybe use some anti-inflammatory agents. And depending on the nature of their joint issue, if it was one or two bad knees that are just really osteoarthritic, I'd be thinking about prolotherapy and ozone injections and PRP injections. And if they lived in a place where they could access peptides and stem cells and things like that, there would be different things that could be looked at. But to my understanding, MSM doesn't really need anything to make it work better. Although, again, someone who I want to use for gut healing, I might combine it with glutamine and, of course, a healthy diet and an anti-SIBO protocol and things like that. So we'd combine it with things more mechanistically, but nothing that it needs, to my understanding, for it to work better. The next one says, I started MSM 4 grams in the morning and 4 grams around noontime for a week. I experienced severe insomnia. Can you please advise how to resolve this? So I've had a few patients over the years where they're very susceptible to insomnia from different supplements, and there seems to be no rhyme or reason to why it's causing insomnia for them, but just certain things seem to trigger insomnia for folks. With MSM, we could try to map out a mechanism by which it might be causing insomnia for someone, but where it's really not a common side effect. I think I've had 1 or 2 other patients that I can think of who have had some sleep disruption from MSM. I think it's more of like it's more of a you thing, not the supplement thing, I guess, for lack of a nicer way of putting it. With those patients, I just ask them to take it first thing in the morning, and that resolved the issue. So that's the kind of simplest solution. Based on my interview with Dr. Janelle and what I've seen in my own clinical practice, the therapeutic difference between once a day versus twice a day versus 3 times a day dosing of MSM doesn't really seem to matter. So if a patient's, say, going to be taking like a really robust dose, like 30 grams a day, whether they do 10, 10, and 10, or 15 and 15, or 30 just once, therapeutically is pretty much the same across the board. I have had some patients, as I believe Dr. Janelle mentioned as well, who seem to do better with dividing it up. So there are exceptions to what I just said. And then some patients, rarely, but sometimes, do find that if they take too much MSM all at once, it bothers their digestive tract. So then we'll space it out, and then that usually allows them to tolerate it just fine. Next one says, I have been taking MSM for 10 days already. Despite the headaches, I'm keeping the dose at 20 grams per day. The protocol calls for 2 months, but when do I know I can start reducing the dose to the maintenance dose? So unfortunately, on social media, I cannot give any direct treatment advice, so I'm not going to give direct advice to the person who asked this question, but I did want to comment on a couple of things here. So one is that if I have a patient who starting MSM, they're building up the dose, and whether they're all the way up to 20 grams or they're only at 2 grams or 5 grams, if they're getting symptoms, headaches, skin outbreaks, night sweats, other detox symptoms, then I ask them to back off on their dose, because muscling through side effects, detox side effects, and really it's not a side effect, it's more of a likely a detoxification reaction that's happening when my patients are experiencing these symptoms, then it tells me that we are pushing some physiological pathway, some mechanism too aggressively. So we need to start backing off on that. So the one thing I wanted to point out here is sort of like, I'm on day 20 and like I'm dealing with the headaches. It's like, that's a problem right there. Like, it's like, okay, this is, if my patient told me that, I'd say, okay, you need to back off of your MSM. Now, I'm not telling the person who asked this question to back off, because I am not their doctor. However, I would, from one of my patients, say, like, if you're detoxing or having a side effect, you need to back off on the dosage. Also, Dr. Janelle does talk about, kind of a 2-month protocol. I have lots of patients, and I know Dr. Janelle does as well, because I've talked to her outside of our podcast as well. We've had a bit of communication and correspondence. Some folks definitely need to be on MSM for longer than 2 months at a full therapeutic dose. So it's not just a 2-month protocol. It can be for some, but certainly not for everybody, at least not in my experience. I don't speak for Dr. Janelle. That's just my understanding. She has patients who are on it for longer than 2 months as well, to my understanding. And then in terms of when do my patients at least reduce their dose to a maintenance dose, when they're getting the maximum benefit from the MSM. So we build up the dose, they hopefully see benefit. If they don't, we stop it, because it doesn't help everybody, but it helps the majority of folks who take it, in my experience. And so get the maximum benefit, and whether that's after 2 months, 4 months, 6 months, 8 months, whenever it is, then we start tapering the dose down, usually fairly rapidly, until they get to a maintenance dose or just are able to stop it entirely. And what are the cofactors that should be taken with high dosages? Magnesium, B's, C's, if so, how much? So actually, I didn't realize this is kind of a question I already answered there, so you don't really need to take other things at the same time. So got a 2-for-1 on that one. And then the very last thing here, I was just posted on one of the MSM videos, so I thought I would just answer it here. It says, I'm convinced that I have gut issues. It's like a rotten smell coming from my mouth. And then apparently we mentioned something about that type of thing in the video. And so it says, is that what you're talking about? So in my experience, when patients have really bad breath or like this rotten smell coming from their mouths, it's either a dental or oral hygiene issue, in which case a dentist could work them up for that, or it's that it is related to putrefaction of things in the gut. It's kind of odd and a little bit gross to think about, but some of the air that we exhale is actually some of the bowel gas that is, or the intestinal gas that is produced in our small intestines. So we actually absorb some of that gas into our bloodstream and we breathe it out. Of course, we burp up some of it and we pass bowel gas for some of it, but some of it we absorb and actually breathe out. So when folks have really, fetid, malodorous breath, if it's not a dental related thing, it's very likely a small intestine putrefaction thing. So that's why we use a lactulose breath test to diagnose SIBO, because we actually breathe those gases out that we've absorbed across our intestinal membrane. If you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thank you in advance for taking a second to do that. If you have any questions about MSM, I will happily do another MSM Q&A video or answer in the comment section if I'm able to. Any questions about any other topics, please post in the comment section below, and I will leave it there for now.